Assalamualaikum and good pleasure to Prof. Dr. Zainas. So today I'm gonna do about the SSM presentation video. Before that, my name is Ahmad Bm23110001. My matrix number is Bm23110001. For SSM presentation video today, I would like to choose the topic is about the integumentary system. So before that, let me introduce Prof about the content and objective for my presentation. So my content and objective, I have the 6 one. The first one is about the introduction, which is about the what is integumentary system. The second one is type of the skin, is hairy or hairless. And the third one is a skin structure, which is the part of the name of the skin structure. The fourth one is about the clinical part. I choose is acne. What is acne? For the fifth one is type of acne, cause and grade of severity, and the last one is the treatment over the counter, or we call this OTC, and consult with dermatologist. Without further ado, let's start our first content. So what is integumentary system? Do you guys know what is integumentary system? Actually, integumentary system is about our skin. So the skin is composed epithelium, connect tissue, muscle, nerve, blood vessel, and associated structure, gland, hair, follicle, and nails. And it's also have divided by two basic layers. The first one is superficial epidermis. The second one is tough collagen-rich epidermis plus fatty hypodermis. So what is superficial epidermis? It consists of the non-vascular, keratinized, terrified, squamous epithelium. For the tough collagen-rich dermis plus fatty hypodermis, is consists of the vascular connective tissue layer. So, for fun facts, hypodermis is also known as a subcutaneous layer, or consists of the connective tissue and adipose tissue. Right? So, next one is about the type of the skin. Actually, we have two types of the skin. The first one is thick, hairless skin. No have the hair in here. For the second one is thin, hairless skin. So for your observation in our body, some part we don't have hair, right? So for the type of the skin, we have two, thick and thin. For the thick structure, we have the epidermis, superficial arteriovenous, flexus, papillary dermis, dermis, hypodermis, dermal nerve fiber, encrine sweet gland, and pacient corpuscles. For the thin one, we have the hair sheath, opening of sweet duct, dermal papillary, head follicle, encrine sweet duct, encrine sweet gland. So, thicker epidermis layer actually is numerous sweet gland, is leg hair follicle, subcutaneous gland, smooth muscle fiber. It's also in the fingertips, palms, and soles. So, for epidermis is thinner, is contain hair follicle, subcutaneous gland, sweet gland, and smooth muscle fiber, which is we call the receptor pili all over the body. Okay. For the our third content is the skin structure. So skin structure, we can see in here the stratum corneum, pore, hair sebum, epidermis, dermis, hypodermis, sweet gland, nerve fiber, fat, hair follicle, sweet gland, and sweet gland. So today, I would like to explain more about the stratum. So, cell layer of the epidermis. So, cell layer of the epidermis, we have the 5, which is the first one is stratum corneum, stratum lucidum, stratum granulosum, stratum spinosum, stratum basal. So, how we want to memorize all these 5 layers of epidermis? It's easy. So, you need to memorize 5 things is come, let's get sunburn. So, C for corneum, L for lucidum, G for granulosum, S for spinosum, B for basal. Okay, so without further ado, let's start for the first layer. Is the deepest layer, which is we call this stratum basal, or we call this basal layer. It's a single layer of columnar to cuboidal cell, which rests on the basement membrane. It's also have the stem cell for the skin. Is highly mitotic activity. So it's attached epidermis to dermis. We call this hemidesmosomal desmosomes. Okay, the second one is stratum spinosum. Is the second layer 4 until 6 row of the cell formed by the mitotic activity of the basal. Spinosome is equal to spiny shape. Alright, these keratinocytes begin to synthesize the keratin in this area part. So the third one, we continue about the stratum granulosum. So stratum granulosum is filled with granules, which is the keratohyalin is granules, keratohyalin granules is contain keratin, and evolving aggregate, cross-link, and form bundle. So lamella granules is released a water-repelling glycolipid into the intracellular space and function as a glue, keeping the cells stuck together. This helps prevent water loss from the body, making the skin relatively waterproof. It generates a large amount of the keratin. The fourth one, we continue with about the stratum lucidum. So stratum lucidum is the fourth layer, is translucent and barely visible. Alright, the cell begin to die, so the nuclei and organelle begin to disintegrate. Usually it's dead cell, we call it cell. Dead cell. So it's leaving behind the keratin filaments is only in thick skin. Memorize and remember, it's only in the thick skin. The last one is the stratum corneum. Actually, the stratum corneum is the fifth and superficial layer, 15 until 30 layer. Is flattened, dead cell filled with soft keratin filament. This keratinized cell are continuous sheet and replace of a new cell. Is always continues with the new cell, replaced with new cell. Okay, we go to the cell in epidermis layer. Actually, in epidermal layer, cell in epidermal layer, we have the four keratinocyte, melanocyte, Langerhans cell, and Merkel cells. So keratinocyte which is the structure cell filled with the keratin. So the Langerhans cells, which is the antigen presenting immune cell. Next is Merkel cells, is a melanin producing cell, and the last one is melanocyte, melanin producing cell. Okay, now we continue about the clinical part. What is acne actually? So acne is a common skin condition that happens when the hair of the follicle under the skin become plaque, sebum oil that help keep skin from drying out, and dead skin cell plug the pore, which lead of outbreak of lesion commonly called pimple or zigs. So in here, this part I would like to explain is about the what type of acne and what cause of the acne. So we continue about the type of the acne. Actually, type of acne, we have the 6 type of acne. Is pupils, blackhead, whitehead, nodules, pustule, and cysts. So for this part, actually, whitehead, we start about the whitehead. Whitehead, sorry, is the plucked hair follicle that stay beneath of the skin and produce a white bump. It's white actually. So next one is blackhead. This one. So blackhead is plucked follicle that reach the surface of the skin and open up. They look black on the skin surface because the air discolor the sebum and not because they are dirty. Okay. The next one is papillus. Papillus is inflammation that usually appear as small pink bump on the skin and can be tender to touch. The next one is pustulus, or we call this pimples. Is papillus is topped by white and yellow pustule lesion that may be red at the base. The second last is nodules, which is large, painful solid lesion and the lodge deep with the skin. The last one is cyst. Actually, the cyst, sometimes we call the cystic acne. This is the deep, painful, and full sweat lesion. It's a very painful acne if you have experience for this pimple. So next one is a cause of acne. Actually, doctor and research believe that one of the more of the following can lead to the development of acne. The first one is excess of higher production of oil in the pore. build up of dead skin cell in the pore, growth of bacteria in the pore. We have 4 types of the factor can increase of development of acne. The first one is hormone. An increase in androgen, which are male sex hormone, may lead to acne. So this increase in both boy and girl normally during their puberty and cause the subcutaneous skin to enlarge and make more sebum. So hormonal change related to pregnancy can also cause acne. The second one is about the family history. Family history is research believe that you'll be more likely to get acne if your parents had acne also. Okay, for the third one is age. People all age can get acne, but it's common in teenagers. The last one is medication. Medication is certain medications such as the medication that contain hormone, lithium, and cause acne. The next one is the grade of acne severity. Actually, we have mild to severe. The mild start with blackhead, whitehead, pupils, and the last one cysts and nodules. Usually, the severe is the painful of the acne. So the treatment of acne, which is we have the three part, which is the mild, moderate, and the severe. So mild actually you can use over the counter, which is what we call the OTC. It's medication cream, cleanser, and spot treatment to help address pimples as they pop up. So as you know, in our country, we have the pharmacy like the Watson and Guardian. You can buy any type of the skincare. For example, the Hadalabo, Oxy, and another brands. They are provide any ingredients in their product can reduce our acne if we have the acne. So its common ingredient you find in any cream is benzoperoxide. Benzoperoxide is the ingredient help try out existing pigment, treatment new one of the forming, and kill acne causing bacteria. So for your information, benzoperoxide you have the many of the percentage. You need, if you the first one or the beginning, you need to try the low percentage first to make sure your skin can tolerate with your benzoperoxide. So for my advice, you need to using the small or the less percentage if you're using the benzoperoxide. So salicylic also is the one of the ingredients, salicylic acid. This ingredient help exfoliate your skin to prevent pore from getting clogged with any causing bacteria. Okay, the next one is moderate. If you continue to experience symptoms after using OTC or over-the-counter acne, you may want to consider reaching out for professional treatment. If your skincare is not tolerate with your skin, you can also go to the moderate one, is go to the professional treatment. So in here, a dermatologist or other healthcare professional can prescribe medication that may help reduce your symptoms and prevent scarring. Usually, if you have the acne, will be fade out. After the acne will fade out, it can make your skin have the scar. So in here, it can help you to prevent the scar happen to your skin, especially in your face. So if you have the moderate skin or moderate acne, a dermatologist will recommend perception strength benzoperoxide, the IC. It have the many percentage of the benzoperoxide. Antibiotic like erythromycin or clindamycin. Retinoid, such as retinol, in some case they may suggest an oral antibiotic or hormonal birth control to help manage acne. Typically, you only use antibiotic for a short time, so your body doesn't build up a resistance and leave you prone or infection. Okay, the last one is severe. For severe acne, a dermatologist may recommend a treatment that combine one or more of the following. For example, is oral antibiotic, benzoperoxide, topical antibiotic, topical retinoid. They may also suggest hormonal birth control, which is come with pill. You need to consult for once per day to take it, or oral isotretinoin, also known as the brand name is Astatine. So Astatine is a vitamin E medication used to treat kitten kids or severe nodule acne. It can cause serious side effect, and doctor usually prescribe is when other treatment doesn't work. So in here, you need to perceive with your dermatologist because it's very dangerous if you overdose or taking it by yourself. You need to consult with your dermatologist to make sure your perception is correct with your body. I think that's all for my presentation SSM. It's about the integumentary system. I would like to say that its integumentary system is talk about the skin, and sometimes for our part clinical, and it will come our face, usually in the puberty and acne and age of the teenagers. I think that's all from me for my assessment presentation. Thank you.